Welcome to the next segment of our microlearning program on healthcare quality improvement basics. This program is based on the model for improvement recommended by the Institute for Healthcare Improvement. This segment will focus on how to incorporate inclusion and health equity considerations into your quality improvement efforts. When asking the three fundamental questions as part of the model for improvement, make sure you include health equity and inclusion considerations in your discussions. Health equity and inclusion should be considered at all steps in the improvement process. Health equity is when each person has a chance to reach his or her full health potential. Social determinants of health, sometimes called social drivers of health or health-related social needs, are the non-medical factors that can influence health outcomes and have an important influence on health equity. Quality improvement efforts can unknowingly improve care for one group of patients while worsening it for another. It is important that you keep health equity considerations in mind when planning and executing your quality improvement projects. Inclusion and equity are part of a SMARTY goal framework, which should be used when establishing your quality improvement aim. They will help you look at your quality improvement efforts through a health equity lens. Inclusion means, have you invited, considered, and incorporated input from the population of focus? And equitable means, does the objective address the unique needs and circumstances of different populations? Asking these questions throughout the process will help your team ensure inclusion and equity are embedded in your quality improvement efforts. Use data sources to help your team identify any gaps in care or other disparities and to support your decision-making throughout the process. Data can help you identify patient populations that may be unknowingly affected by your quality improvement efforts. Use data to help identify these populations and incorporate measures to ensure they are taken into consideration and not negatively affected. Culturally and linguistically appropriate services, or CLAS, are services that are respectful of and responsive to each person's culture and communication needs. Following the CLAS guidelines can help your team consider your patient's cultural beliefs, preferred language, health literacy, and communication needs. Incorporating culturally and linguistically appropriate services into your quality improvement effort is one way your team can address health disparities. When we talk about health equity and social determinants of health, the topic gets very big very quickly. Don't let the enormity of the topic stop you from taking action. Start small and ask what your team can do now and what is within their power to address. The next segment covers how to establish SMARTY goals to support your quality improvement efforts.